Thank you, Jamie and Cameron, for the wonderful, inspiring stories. To echo that, I take care of cancer patients all day, being involved with LFSA and the organization and seeing it grow has been one of the most rewarding aspects of my life. So, good morning and welcome. My name is Robert Lufkin. I'm the medical director for the Lee-Fraumeni Syndrome Association and also a medical oncologist. In addition, I have family members who are affected with LFS. Again, like others have mentioned, I'd like to extend a sincere welcome to everyone, particularly a thank you to Dr. David Malkin, Sick Kids, for hosting this unprecedented, fabulous event. Welcome to all attendees, scientists, researchers, physicians, genetic counselors, and students. Importantly, also welcome to all the LFS families here in attendance. Your presence is what makes this such a unique event. Also, thank you to my LFSA colleagues, the Life Consortium, and Sick Kids for putting so much work into planning this meeting. It's truly monumental. Over the last several years, it has been remarkable to see the growth of the worldwide LFS patient and research community. The diversity of attendance and substance of this meeting speaks to the unprecedented level of interest in LFS and P53-related cancer predisposition. As we gather for this 4th annual LFS Association Symposium to reconnect, share stories, kindle friendships, remember those lost, and hopefully foster research collaborations, we are inspired by the continued steadfast dedication of the LFS research community, specifically the Life Consortium, as well as the strength and perseverance of our LFS families. Since our inception in 2010, the LFSA has awarded over $500,000 toward promising research. This is not including our patient support initiatives, such as teen workshops and conferences such as this. Over the last year, the LFSA has continued its efforts to support innovative, impactful research. For a second year, we have supported the Life Consortium Data Coordinating Center patient database at the City of Hope under the direction of Dr. Jeffrey Weitzel. The international collaboration this has fostered has led to recent important publications and hopefully many more to come. In addition, we've lent financial support to studies involving the development of improved family history tools, MRI surveillance screening, circulating tumor DNA for early detection of cancer, and Dr. Schiffman's work with elephant P53 research. Yet our efforts for improved recognition of LFS and better surveillance strategies are not enough. It is the mission of the LFSA to steer patients and families to the best available treatment options worldwide, as LFS-related cancer remains a challenging endeavor. LFS itself is unique among cancer predisposition syndromes in its effect on disparate age groups, varied tumor histologies, multiple organ and body systems, variable penetrance, increased risk for second primaries, and potential radiation-induced cancers. Yet there is one underlying theme, which is P53. But there is intense recognition that we need to go much, much deeper, identifying potential risk modifiers as well as other novel gene targets. As mentioned, even in the care of common LFS core cancers, there is often significant treatment uncertainty. We are now experiencing a dramatic sea change in the therapeutic landscape of cancer treatment. CAR T therapies are promising for even solid tumors. CRISPR for gene editing is becoming a reality in several diseases. There are multiple newer targeted drugs for refractory cancers with remarkably high response rates to targets that were unknown until just recently. We're using immunotherapy treatments for cancer independent of tumor subtype. Successful combination immunotherapies have been implemented for some of our most difficult to treat cancers. And even drugs for specific germline mutation-associated cancers are now approved. There's also been a proliferation of local therapies, increasing availability of proton radiation therapy, tumor-treating fields in glioblastoma, laser interstitial therapy for brain tumors, and hyperthermia for soft tissue sarcoma. The complexity of cancer care has become such an issue that the American Society of Clinical Oncology has launched a precision medicine initiative and even an accompanying journal of precision oncology to help us navigate our way in an attempt to provide the most appropriate care for each and every patient. As we go hurtling forward, how these and other advances will affect those with LFS-related cancer will be challenging to ascertain. This certainly will not be done in the context of traditional clinical trials. A recent story in the news regarding several women with a very rare cancer, specifically small cell carcinoma of the ovary hypercalcemic subtype, is instructive. They were members of a private online chat group for those affected, and they shared the results of their treatment with anti-PD-1 therapy in this online forum. Although separated by continents, their dramatic responses to treatment that was felt very unlikely to work was shared and ultimately helped define a new successful therapy. In addition, it aided researchers in confirming the gene that was driving their cancers. Although this is not an LFS-related cancer, their story is emblematic of the potential positive power of our social networks and the connectivity of our current time. The answers in the era of precision oncology will need to come from all available sources, including exceptional responses, as well as those with refractory cancers. LFS-related cancer may be the prototypical example of precision oncology in action, incorporating novel new therapies with unique mechanisms of action that surmount the challenges of our more traditional previous therapies. I have previously mentioned that your experiences and the experiences of your family are important, they have meaning, and they should be told. The framework for capturing those stories is being built today. This framework is built on the foundation of discovery that was laid by Dr. Lee and Dr. Fraumini, and has been propagated by those that have come after them, the Life Consortium, the LFSA and its efforts, our new international chapters, and you are all adding to the framework that will eventually provide the clarity and the way forward to optimally treat and prevent LFS-related cancer. The LFSA would like to challenge, encourage, and empower you, including young investigators, to think boldly. I'm looking forward to a wonderful meeting and speaking with many of you anytime, here or thereafter, to discuss opportunities to promote and fund LFS-related research. Thank you.